Hello, my name is Hannah Lee, and this is my psychology in film project. So the film that I chose is Frozen, and it's a Disney animated film that depicts the story of a fictional kingdom called Arendelle that's inspired by 1840s Western Norway. The story follows two royal sisters, and I'll be focusing on Elsa, who's a crowned queen who grew up being taught to isolate herself and lock her true self away due to an incident where she accidentally hurt her sister. This film shows a lot of main themes of overcoming trauma and emotional pain. So what I diagnosed Elsa with is generalized anxiety disorder. GAD is a persistent and ongoing anxiety that causes extreme and frequent worrying even with little to no reason. This condition can last months or even years, and it's often due to experiencing a traumatic incident or being in a stressful environment. Some symptoms that I see Elsa having of these is isolating herself in fear of messing up or harming others, which is often symptoms of social anxiety, which those with GAD have. After an incident where Elsa unintentionally hurts her sister, she's taught to conceal her powers, which in this film is symbolic for her emotions, and she isolates herself in fear of harming again. And after 10 years of isolation, the kingdom especially opens up their gates in honor of Elsa's coronation, where she's put in front of a lot of other people, and she's constantly scared of ruining her image or accidentally hurting another person. Another symptom that I see her have is frequent panic attacks, and there's many accounts where she experiences one, specifically her coronation ceremony, where her powers are revealed to the kingdom, and where Anna reveals that Elsa has cursed the land with an eternal winter. In all these instances, Elsa's anxiety takes over her, and we can conclude that these are panic attacks because she has tense posture, shortness of breath, and seeming disassociation. And her emotions seem to manifest in her powers, and when she loses control of her emotions, she also loses control of her powers. A symptom that I don't see Elsa having, though, is perfectionism, which can be described through extreme or frequent concerns regarding someone's performance in their jobs, activities, or overall responsibilities. With Elsa, she seems to have a reasonable amount of self-consciousness about her role as a crowned queen, and can even be argued that she has little to no care about her responsibilities as the queen, as she runs away from the kingdom and has no remorse in doing so. Some aspects of her culture that reflects her diagnosis is that in the film, she goes to see a doctor, and his treatment plan states that Elsa should isolate herself and hide her powers. So, symbolically, this means that in their culture, they believe that Elsa's emotions are too intense and show risk to have the ability to harm, so they advise her to just hide and repress her emotions and keep herself away. This represents a stigma around mental health in many cultures where they believe that addressing it just causes unnecessary harm or that it's just simple stress, and often that they show that people with mental health are unsafe. So stigmatism around GAD broadly across other cultures is that GAD is prevalent, but more than often it's not diagnosed because of the stigma around mental health being seen as a disadvantage or not being able to take it seriously. And in our culture, it's often seen as a weakness or not taken seriously, as many people just brush it off as worrying. My treatment plan for Elsa consists of a psychotherapy called cognitive behavior therapy. CBT for GAD shows statistically significant reduction in anxiety symptoms in patients. This treatment typically consists of hourly-ish sessions that focus on the communication between the patient and the doctor and identifying causes for GAD and trying to desensitize the patient to these factors. Some ethical concerns regarding CBT is that it relies on exposing the patient to their causes of anxiety and desensitizing them to the problem. However, this method is very anxiety-inducing at the beginning, although it's argued that the temporary anxiety is needed in order to combat against the anxiety from reoccurring so-and-so. Some limitations I see Elsa having is that in the context of Frozen's cultural landscape, they're based off Western Norway in the mid-1840s. Norway first passed a law on the treatment and care of the insane in 1848, but mental health services weren't improved until late 1900s and early 2000s. In the film, Elsa is imprisoned and restrained for her instability and treason. It seems that in this film's cultural landscape, Elsa would not be able to receive proper treatment for GAD, and if not, being punished for entirely for having it. From a broader perspective, I see that Frozen doesn't outright address these symptoms or issues, but they do a good job of representing GAD through symbolic and more exaggerated terms by representing Elsa's anxiety through her eyes powers. The film builds context to understand when and how Elsa's anxiety develops and what causes it and how it affects her both emotionally and physically. In real life, we never know what's going on in one person's life. However, in film, we see the whole story. Portraying mental disorders through films, especially through exaggerated symbolism, helps the audience understand what the disorder may look like and how it can develop through multiple examples. And that's it for my presentation for my psychology in film assignment. Thank you.